Howdy, guys. Welcome to our podcast for today. We have a great show today. So, by popular demand, you guys had wanted me to do a deep dive on everything you need to know about gluten, celiac disease. Is it good for you? Is it bad for you? What are the risks? What the heck is going on? Well, in today's podcast, we'll discuss that. We'll discuss details. We'll discuss exactly, should you be on a gluten-free diet? Should you be tested for celiac disease? What does that even mean? And your questions as well. So I'm excited for today's podcast today. So if you're joining for the first time, who am I? Well, I am Dr. Islam. I'm a board certified gastroenterologist. I train at the Mayo Clinic in gastroenterology. I've been doing this for over 10 years. I've treated thousands of patients with gluten issues, with celiac disease, and I published papers as well. And so I'm an expert in this. Every week we do a podcast in which we do a deep dive on a topic that you guys want me to talk about. We'll talk about everything you want to know about that topic. And I also go on my live stream as well, my social media channels on YouTube and on Facebook and on LinkedIn to answer questions you guys have as well. So if you're listening, thank you for listening. If you're watching, thank you for watching. And if you're on the live stream, don't forget to put in the comments where you guys are watching this at. Are you watching this live or on the replay? And any questions you guys may have as well. So I hope you guys are having a great week. I love this time of the year. Oh my goodness. I'm a huge basketball fan. What a playoffs that we've been having so far. I'm a big Mavs fan as well. So I'm so glad that the Mavericks are in the Western Conference Finals. I cannot wait to see what happens next, nor can I wait to see what is going to happen in the playoffs. So I'm really excited about what is happening and what is going on as well. Christina, thank you for watching from New Mexico. And let me know once again if you're watching this on the live stream, on the replay as well. All right, so let us do our deep dive on our topic on celiac disease and gluten issues. So let's talk about gluten. What exactly is gluten? So confusing for so many different people, and you see so many things that are out there when it comes to gluten. So gluten is a substance that very commonly is found in certain carbohydrates or foods that we eat, mainly just carbohydrates are the main foods to have there. And for the longest time, people have wondered, hey, is there something going on with this gluten thing? Because so many people have noticed that they're having issues when they ingest gluten. And so studies started to come out on some of the issues that occur with gluten for some individuals. They develop some bloating, some nausea, some distension, and maybe even some reflux, diarrhea, and other symptoms. And so not only that, we came to realize that for certain individuals, they tend to have a lot more serious complications when it came with gluten. And actually, they did more research and they came to realize there actually is an autoimmune disease in which your body attacks itself whenever you ingest gluten. And thus came the diagnosis of what's called celiac disease. So let's talk about this. What exactly is celiac disease? So celiac disease is a autoimmune disease in which your body actually attacks itself when you ingest gluten. So you have to have the right genetic predisposition, you need to have a triggering factor, and you need to have a response of that triggering factor as well. And so that's exactly what happens when you have celiac disease. You have individuals that already have a genetic predisposition for celiac disease. Some sort of response occurs that triggers an autoimmune reaction, and so you ingest gluten, and that causes the symptomatology to occur. So you have to have the autoimmune disease process with a genetic predisposition with a triggering event to be diagnosed with celiac disease. So what are the symptoms that are very commonly associated with celiac disease? And you may notice these. They're very non-specific symptoms. So things like bloating, nausea, diarrhea, heartburn, sometimes even reflux symptoms as well. But not only that, it can present in so many different ways. Transaminitis or elevation of your liver function test, even constipation, even something as simple as anemia or iron deficiency anemia. All these are within the spectrum of what's called celiac disease. So commonly in my clinic, I see patients who get referred to me for any number of different reasons. And one of the things I have to think about is a condition called celiac disease. So I'll give you an example. I had a young lady come see me a couple of weeks ago whose only symptom was that her liver numbers were inflamed. She had no GI symptoms whatsoever. She did not have diarrhea. She did not have bloating. She did not have distension as well. So it was kind of weird because I'm looking at her. She doesn't have the risk factors for liver disease. She's not obese. She doesn't drink alcohol. She doesn't take herbal medication. So we did the normal tests that we do. We checked her for any genetic abnormalities. All were normal. We checked her for viruses. All were negative, but we checked her for celiac disease. And guess what? That celiac disease marker came back high, and we actually diagnosed her just on liver enzyme elevation with celiac disease. Another patient came to see me with full-blown GI issues, bloating, diarrhea, just not feeling good. She got diagnosed with IBS, and she was treated with so many different IBS type medications. Nothing seemed to work. So I was thinking to myself, all right, something's weird here. She has this diagnosis of IBS. I'm not sure about that to begin with, but let's go with it. She's on treatments for IBS, but she's not feeling better. What is going on? So we did some further investigation. We actually tested her for celiac disease, and she actually had that instead of actually having IBS. And so the treatment for celiac disease is very different than the typical treatment for IBS, which we'll talk about in just a little bit. So how do we diagnose somebody with celiac disease? Well, the first thing is that we have to do is that we have to have a high clinical suspicion. So you have GI symptoms and then you have non-GI symptoms. So let's talk about the GI symptoms. So in the GI tract, when someone comes to see me and they think they have celiac disease, they'll present with diarrhea. It's the biggest symptom people have. But it's not just any run-of-the-mill diarrhea. It is diarrhea with warning signs, with weight loss, with diarrhea waking up in the middle of the night, with nausea, with pain. Let me tell you, diarrhea is very common, but diarrhea should not wake you up in the middle of the night. It should not cause weight loss. And so when I see medical students come to see me and we talk about diarrhea, yes, I know it's crazy. We talk about diarrhea. I tell them, it doesn't matter what your diarrhea is. It should never wake you up in the middle of the night. It should never cause you to lose weight. If that is occurring, something else is going on. It's not typical diarrhea, and for sure it's not IBS. So diarrhea is one predominant symptom. Number two is bloating. Absolutely, bloating in and of itself can be a symptom of celiac disease. And so I have diagnosed patients with bloating alone with celiac disease. But you also have other non-specific symptoms. Not feeling very good, feeling fatigued, feeling nausea, just not feeling good, having a lot of just heartburn, even constipation. I've had one patient who has constipation that presented with celiac disease. These are the GI symptoms. But you could have non-GI symptoms of celiac disease, and this can be tricky because you have to have a high clinical suspicion of this. These include iron deficiency anemia. So if you are anemic, we don't know why, we may check you for celiac disease because you cannot absorb the iron that is there. If you have skin rashes, there are particular skin rashes that are associated with celiac disease. The typical one is Terbatitis herpetiformis. This is a very itchy skin lesion on the extensors, and this has almost 100% correlation with celiac disease. In fact, when I teach medical students, I tell them when you have somebody who has an itchy rash on your elbows and on your knees, you need to check for celiac disease. This has a high predominance of being associated with that. Brain fog. Absolutely. We have a lot of patients that just have brain fog. They don't know why things are so fuzzy all the time. And that can also be a manifestation of celiac disease. You can have joint issues. 100%. Once again, this is another manifestation of celiac disease. So the GI issues is pretty easy to kind of figure out and have a differential for that. But it's the non-GI symptoms that you have to have a high clinical suspicion to see exactly what is going on, to see if we can find out if you have this or not. So let's assume we did our work and we're like, I think you have celiac disease. How do I diagnose you? Well, there are two tests you have to do. One is a blood test and one is an upper endoscopy. There are 3 different blood tests that are out there when it comes to celiac disease. There's what's called the TTG. There's also called the ADA or the anti-endomyocin antibody. And there's also a couple other blood tests that are out there as well. What I tell my medical students and what I tell anti-Gluten antibody, I had a brain fart there. I apologize for that. You have the TTG, you have the tissue transglutaminase, You have the anti-endomyocin antibodies, and you have the anti-gliadin antibodies. What I tell my medical students is that out of all the tests you can pick, blood testing for celiac disease, the one you have to check for is one that's called a TTG. And so if you're going to order a blood test, or if your doctor's going to order a blood test, it needs to be a TTG. Here's the kicker, and this has confused a lot of patients. You need to be on a gluten-rich diet if you do this test. Why is that? Because if you're on a gluten-free diet, guess what? It's going to be normal. It'll be falsely normal, and I can't diagnose you with celiac disease. And so not only do you have to do the right test, which is the TTG, you have to be on a gluten-rich diet in order for that test to be accurate. If you have an elevated number of the TTG, typically greater than 15, depending on your lab, then you do an upper endoscopy or an EGD so you can see the damage going on inside your small intestine. You actually need both tests to confirm celiac. A positive or elevated TTG and a EGD with biopsies of your small intestine to see what's called villus blunting. So your small intestine or your duodenum or small intestine have these villi that are there. They're constantly absorbing nutrients like vitamin D, iron, other nutrients. When you have celiac disease and you ingest gluten, that autoimmune reaction actually shears off those villi so you can't absorb anymore. And this leads to all the symptoms that occur with celiac disease: the bloating, the dissension, the diarrhea, the brain fog, the anemia, the liver function tests. And so it's the combination of the two that gives us the actual diagnosis of celiac disease. So if we have both, we have it. We have one or not the other, guess what? It's not celiac disease. There are other conditions that can cause an elevated TTG with a normal EGD, and there are other conditions that can cause villus blunting on an EGD, but a normal TTG. So you need both to give you a diagnosis of celiac disease. So now that we have that, what do we do? Well, the mainstay of treatment when it comes to celiac disease is a gluten-free diet. It is a dietary treatment that we offer and that we give for our patients with celiac disease. Currently, there is no medical options when it comes to celiac disease. There's no pill that I can give you. But here's the thing you need to know. It's not just being on a gluten-free diet. You got to be gluten-free of everything. So no cross-contamination, no gluten in drinks, no gluten in candy, no gluten in lotions or shampoos or nail polish. It's any sort of gluten that needs to be completely eliminated from your diet and from your body as well, because any small ingestion of gluten is going to cause you to cause damage to occur. So what's the big deal? Who cares if you have celiac disease or if you have continual inflammation? Well, the problems that occur when you continue to ingest gluten is that you have the complications that can occur with celiac disease. So you can become anemic. You can lose vitamins, especially vitamin D. You can develop a lot of GI issues, but there's also a risk of developing a fatal cancer, specifically a T-cell lymphoma. So continual gluten ingestion in someone who has celiac disease can over time lead to cancer or lymphoma of the gut, which unfortunately is universally fatal. And so we need to make sure we can do what we can to treat these patients and get them on the right track. So let's say that you have an individual, or you are that person that's on a gluten-free diet. You're feeling better, you're doing good. How do we follow up? What do we do? So we typically check serial blood testing every couple months or a couple years to make sure we're on the right track. So we check what's called that TTG. We want it to go down and we want it to be normal. And at some point in time, we can do another EGD to take a look at the small intestine to make sure the villi have come back. Your small intestine villi can and will come back if you continue to not ingest gluten. It's remarkable what your body can do, but these villi do come back, and that TTG should go to normal. Here's a common board review question I tell my medical students. Let's say you have an individual that has celiac disease, that's on a gluten-free diet, that says, hey doc, I feel great. I am back to normal. You cured me. Yay! Go me. But you check their blood testing. It's still high. The TTG is still high. What is going on? Why is that the case? Why do I see this discrepancy? Even though the patient tells me they're on a gluten-free diet and they feel good, why is the numbers high? The most common reason number one, reason number two, and reason number three is inadvertent gluten ingestion. You may be feeling good, but somewhere you're ingesting gluten or you're not being as strict as what you're telling me. And once again, because of that, you can develop the risk factor for developing lymphoma, which can lead to long-term complications as well. So if you have celiac disease, you need to get on a gluten-free diet. You need to maintain on a gluten-free diet. It has to be lifelong. Now, because there is a genetic predisposition for individuals with celiac disease, you typically need to test your first-degree relative with the blood testing to see if they have it. And if they happen to have an elevated blood testing, then you need to do another EGD to confirm that they don't or do have celiac disease as well. Now, that's the summary on celiac disease. Let's move on to gluten. So there are a lot of individuals that are gluten sensitive. This is very different from celiac disease, meaning you actually don't have the autoimmune reaction that's attacking your body when you have gluten sensitivity. You have the intolerance to gluten. You don't feel good. You can manifest in a lot of the symptoms with bloating, distension, nausea, but you actually don't have an elevated TTG and you don't have abnormalities on your upper skill. But also more importantly, you don't have other long-term consequences that can occur with ingesting gluten, meaning you will not have malabsorption of vitamins and nutrients. You will not have elevation of your liver enzymes, and you certainly will not develop the type of lymphoma that celiac disease can present with as well. And there are a lot of individuals that are gluten intolerant. That is a real problem to have, and a lot of people have this issue. And so I don't want you to feel like, oh my gosh, I'm kind of weird because I can't ingest gluten. Not a big deal. Come see someone like me. We can find out exactly what's going on and hopefully figure out what we can do to get your celiac disease or even gluten issues taken care of as well. All right, perfect. Well, that's kind of our deep dive on celiac disease. Let's answer some questions that you guys have as well. So one question that was asked from Ron. Thank you for watching, Ron. So one question that was asked from Ron. Thank you for watching. Hey, Dr. Islam, I don't feel like I'm emptying everything out when I use the restroom. What is going on? I like this question because I hear this question all the time in my practice at Lubbock Gastro. Come see us, Lubbock Gastro, for all your GI needs. Don't forget to come see us if you have any issues. The most common reason why people feel the inability to empty is that they're actually not emptying everything. And the reason they're not emptying everything out is that they could have a condition called a pelvic floor dysfunction or some sort of rectocele or some sort of blockage in your rectum. So when I have someone come see me and say, hey, Dr. Islam, I don't feel like I'm emptying everything out, there are a couple of tests that I'm going to do to find out what is going on. So number one, I'm going to do a colonoscopy. I want to get a visualization of what is going on. I want to make sure there's not an actual blockage in your colon. I want to make sure there's not a mass, a polyp, or things like that. Number two, I may do what's called an anal rectal manometry. It's kind of weird, but for a lot of my patients who have incomplete evacuation, the rectum muscles, this is your bottom right here, is so tight that nothing wants to get open. So it opens and shuts, opens and shuts, opens and shuts. And that's not what we want, because you want it to be open and everything comes out. The natural way we do our poo, it's kind of weird, I'm going to mimic poo, is that stool goes into the rectum, and then this is the rectum right here, this is the anus, it opens up and it pushes down and everything just comes out. For people who have pelvic floor dysfunction, it goes in here and then opens, close, opens, close, opens, close, but the rectum gets bigger and bigger and bigger. And so because of that, you feel like you're not emptying everything out. And so we may do what's called a manometry, in which we actually measure the pressure of your rectum to find out what is going on. Is it hypertensive? Is it too much, or what is going on? We also may do imaging of your rectum as well to see if there's some sort of cyst or blockage or rectocele that could be contributing to the sensation of not being able to get everything out. So that's another common reason why people have issues when it comes to constipation as well. So I'm glad you asked that question. Next question from Lewis. Hey, Dr. Islam, I cough after I eat. Why is that the case? So I get a lot of referrals from ENT doctors and pulmonologists who tell me, or their patients, they come to see me because they're wondering if there may be a GI reason of why they cough when they eat. And there are. One of the more common reasons why you may cough after you eat is because of acid reflux. Even though you may not feel it, acid reflux can actually cause you to cough after you eat. So whenever you eat, you produce this acid inside your stomach in the preparation of digestion of food. And the acid for some individuals can go up into the esophagus and into your lungs to cause reflux and coughing to occur. And so this is a very common reason why people cough when they after these. So what do I do? So there are a couple different tests that we can do to kind of see what's going on. Number one, we want to try and put you on a trial of an acid medication, at least for 8 weeks. That trial of acid medication is going to give us a diagnostic response. So for example, if we put you on the acid medication and the cough goes away, well, guess what? I can tell you that absolutely your cough is related to acid reflux. We know what's going on. We also may do what's called an upper endoscopy or an EGD. So I can see myself, is there damage in that esophagus that may be from acid reflux? We can check for hernias, ulcers, and things like that. And also we may do pH testing. I may actually measure the amount of acid going up into your esophagus to see if that's causing you to cough as well. But a common reason for coughing after you're eating is from acid reflux. If you have that issue, come see us so we can find out exactly what is going on. Hopefully get that taken care of for you as well. So a question that was asked, can colon cancer show up in blood work? And this is a trick question. I like this question because it can't directly show up in blood work. So there are a couple of different clues that we can do on blood work to see if you have colon cancer. So number one is anemia. So unclear anemia is a sign, or could be a sign, of colon cancer, because when you have a big cancer in your colon, it ends up bleeding, and that blood over time can cause you to become anemic. And so this is one way that we can do. Number two is that some people check what's called a CEA. Now, a CEA is a non-specific cancer marker that we use to see how colon cancer is doing once you've had cancer, but there's no indication of using this as a screening test. So some people do this, but it's not an indicated test. The best way to check for colon cancer by far is to get a colonoscopy. So if you're worried about your risk, come see us at Gastro or see a GI doctor so we can see exactly if you have the risk factor for developing colon cancer. All right, next question. Hey, Dr. Islam, I have pain in my bottom. What exactly is going on? So there are 3 reasons why you can have a pain in the bottom, and I'll give you 3 quick fixes to get that taken care of. Reason number 1 is you can have what's called a fissure or a tear in your rectum. A paper cut in your rectum is not fun. Your rectum does not like to have a paper cut. It doesn't like that at all. Any type of irritation in the bottom is not good because all the blood flow and all the vessels that are there. And so if you have even a small paper cut, that can cause pain to occur. Number 2 is you can have a thrombosis in your rectum. Whether it's a clot that's there, that can cause severe pain as well. And then number 3, having hemorrhoids. Having hemorrhoids can cause a pain in the rectum as well. So when someone comes to see me and they have a pain in the butt, what do? Well, the first thing I do is I do a rectal exam. You can get so much information by doing that alone. And if your doctor's not doing a rectal exam for rectal pain, you tell them to do it, because I can check for fissures. I can check for hemorrhoids. I can check for masses as well, because another reason for pain in the rectum is actually a cancer. Absolutely, it can be the case. And so a rectal exam is a good way to do that. Now, based on my rectal exam, that's going to allow me to figure out what the next steps are. So for example, if it's a fissure or a tear, I'm going to give you creams to help out with that. I'm going to give you creams to relax the sphincter so it can heal up that tear, and we'll give you creams to resolve that. If there is a hemorrhoid, I will fix that hemorrhoid. We do it here at Lubbock Gastro. It takes about 10 seconds to do. It's quick, it's easy, and it'll fix up your hemorrhoids. If I feel a mass, I'm going to do a colonoscopy and see exactly what is going on. And so that rectal exam is an important test for us to dictate the next steps to hopefully get things taken care of. The most common reason for pain in your bottom is a hemorrhoid or is a tear. And so these are easy fixes that we can do to hopefully get our patients taken care of as well. All right, perfect. All right. Next question. Hey, Dr. Islam, I have a lot of throat clearing whenever I speak, whenever I talk. I was told this is due to acid reflux. What is going on? So this is a very common condition as well. In fact, this is called LPR, laryngopharyngeal reflux. And this is a reflux manifestation of acid reflux. And so when you have acid reflux, that acid can go up into the esophagus and go into your vocal cords and into your throat to cause coughing, throat clearing, feeling like there's a frog inside your esophagus. And so one of the more common reasons for that is just the inability of your esophagus to keep the acid down and the inability of the sphincter to work properly. And so obviously the treatment for this is to treat the acid reflux, treat the underlying cause. So when I have someone referred to me for LPR, in fact, I had a patient last week who came to see me, hey, Dr. Islam, I am constantly clearing my throat. What do I do? Well, the first thing I did for this patient is that I put her on a PPI. We put her on an acid-reducing medication because I wanted to see the clinical response to that. And the best predictor of LPR is your response to an acid medication, meaning you take the acid therapy and your symptoms get better, then you most likely have acid as the cause for that. The other thing is that I did recommend an upper endoscopy or an EGD to see what's going on, because with that, I can check, is there damage in the esophagus from acid reflux? Is there a stricture? Is there a hernia? What is going on? So I can truly assess what we can do to get things taken care of. And for some individuals, we actually may do pH testing as well to objectively measure how much acid goes up to see if you have LPR or not, so we can hopefully find out what is going on. It's a very common symptom. If you have these issues, throat clearing, frog in your throat, feel like there's a lump that's there, come see us up at Gastro. We can find out what is going on and hopefully get that taken care of as well. All right, guys, that's the end of our podcast. I hope you enjoyed this show. If you liked what you saw, come see us on our YouTube page. If you liked what you hear, give us a 5-star rating on our podcast as well. Let me know if you want me to make any changes, do a deep dive, what topics you want to do. We would love to get your comments and your responses. And if you haven't already, don't forget to smash that like button, like, share, and subscribe. And come see us up at Gastro for all your GI needs. Hope you guys have a happy and healthy week. Thanks and take care.